Welcome to this online educational resource for ASHP ACPE accredited Pharmacy Technician Education and Training programs. This module will focus on developing a strategic plan for your program. Not only is this topic very important for successfully running your program, but it also is one of the highest areas of noncompliance to the standard by pharmacy technician programs. After review of this learning resource, you will understand the definition of a strategic plan, be able to discuss the value of strategic planning, be able to identify the 4 phases of the strategic planning process, and be able to describe the ASHP ACPE accreditation standards for education and training in respect to strategic planning, specifically standard number 7. Let's review the definition of the strategic planning process. There's a lot of information here, so let's break it down into 3 distinct sections. The first section of the definition indicates that a strategic plan is an organizational management activity that is used to set priorities and focus energy and resources. This refers to the direction that you want your program to go towards, and how to describe what resources are needed and how to focus the energy in that direction. So an example may be related to recruitment, and your plan to recruit, have a robust number of students, retain your students, and how you will continue to have a healthy number of students in each incoming class. The second section of the strategic plan states, strengthens operations, ensures that everyone is working towards common goals, and establish agreement around intended outcomes and results. A good strategic plan ensures that all the employees are on the same page and are working in the same direction. In your case, if your program is located in a college, the goal is to have all faculty, administrators, and advisory committee members on the same page. In a health system, all members of the pharmacy involved in the program are in agreement. Note that many of the advisory committee members are usually pharmacy staff members in a health system-based program. If your program is located in a retail or chain setting, everyone at the corporate level, instructors, regional trainers, and preceptors should all be in agreement. The last section of the strategic plan states, assess and adjust the organization's direction in response to the changing environment. A good strategic plan is a living document which adapts with changing environments. Again, in your case, make sure that you and your team are reviewing and revising the strategic plan on an ongoing basis, including involvement and review from your advisory committee. There are 6 aspects to a strategic plan. Number 1, as we just discussed, a good strategic plan is a living document, so it can be amended when changes arise or different goals become a priority. A good example that we've all lived through over the past year has been the impact of the pandemic on everyday operations. Many programs had to change operations and protocols to adjust for the impacts of COVID-19. This impacted how programs operated and delivered learning to students, and many programs incorporated virtual learning and/or transitioned to hybrid educational methodologies. This is a good example where revisiting a strategic plan is necessary to ensure any or all changes to a program align with the program's mission and goals. Even if the changes are first imagined as short-term, going through the process of strategic planning could reveal solutions for the long-term benefit of the program. Number 2, since the strategic plan is a living document, it should be referenced and utilized often in order to keep everyone on the advisory committee and in the program accountable for achieving the goals set in the strategic plan. Number 3, therefore, it should be updated often to track progress made on the goals and objectives set. Updating the plan often also enables it to adapt with changing environment and needs. Number 4, multiple perspectives are required to make a strategic plan effective, such as members of the advisory committee, program directors, and instructors. This also encourages communication between administration, instructors, and the advisory committee to meet the program's goals. Number 5, the strategic plan needs to be reviewed by the advisory committee so that the goals and objectives are up to date with current community best practices. And finally, number 6, any goals identified do need to be SMART goals. SMART is an acronym to remind you of the important aspects of a goal: specific, measurable, achievable, relevant, and time-bound. To create SMART goals, follow these questions to frame your goals. S stands for specific, which questions what needs to be accomplished and what actions need to be taken. This should generally answer the 6 W's: who, what, when, where, which, and why. M stands for measurable, which is pretty self-explanatory. How are you going to measure the goals that you set? These measuring tools can be quantitative, such as 90% graduation rate, or qualitative, such as student surveys or evaluations. A stands for achievable. Ask yourself, are the goals reasonable, and what resources are needed to make the goal achievable? This is meant to inspire motivation and creativity. An example of this may be to obtain certain equipment that is needed for the simulation lab. R stands for relevance. Does the goal align with the mission and vision of the program and why the outcome is important to the program's values? This sets priorities on what goals the program needs to focus on. T stands for time-bound. This asks for a reasonable time frame to complete the set goals. These dates ensure that target dates for deliverables are set and creates a sense of urgency to complete them. It is important to ask a lot of questions when designing goals. The answers to these questions will help you brainstorm strategies to ensure that these goals are attainable. A good strategic plan requires a critical analysis of the gaps in a program and a plan to close those gaps, which improves the conditions within the program. During the gap analysis, the team works together to come up with creative and innovative ways to close those gaps and add them to the plan. Once the plan is set, it is easier to work towards the change. To write this document, discussing with your staff is very important, so that you may understand what the program looks like currently and what the program's needs are. This increases the vertical communication between administration, the advisory committee, and the instructors. The instructors are also encouraged to communicate between each other to compare what each classroom's needs are. And finally, this document should outline the mission, value, vision, and common goals of the program, which guides everyone to look towards one document to guide decisions that are made within the program. There are 4 phases involved in strategic planning. First is the pre-planning stage, which sets the foundation for the plan. Next is the planning cycle, which involves research within the program and setting the goals from the gap analysis and SWOT analysis, which stands for strengths, weaknesses, opportunities, and threats to the program. Then there is the annual review process, which is typically done by the program director, college administration, and the advisory committee. Finally, the end of plan review, which happens at the end of the 3-year life of a strategic plan. This is a cycle and therefore is a living and evolving document and process. The pre-planning stage involves 3 steps. The first step is developing preliminary findings. This is the foundation of the program where a mission and purpose or vision statement for the program is laid out. A mission statement is 1 to 2 sentences on what the institution hopes to accomplish, and the purpose/vision statement are specific characteristics or features that will define the program's future state and make the program stand out. The second step undertaken is to evaluate the success of the program. This task identifies the progress made by the program since the last time the document was reviewed, as well as what the program is doing well and areas of improvement that may need to be addressed. The last step is review by the planning committee in charge. These are the people involved in the program who helped in creating this document and involved in tracking its progress. List all the faculty members involved in creating the tracking of this document. This can also include the advisory committee members. The second phase in strategic planning is when the planning cycle begins. The planning cycle contains 6 components. The first component is to review the mission/vision statement. This builds on the pre-planning step. This ensures that the mission and vision statement is up to date with the program's values since the last time it was updated. Second, environmental scan is research done to compare with other programs. This guides the goals and objectives to reflect future trends in the profession and can compare where the program stands against other programs. Third, a SWOT analysis is a tool to help recognize the strengths, weaknesses, and opportunities that can be attributed to the program and threats that may negatively impact the program. Fourth, a gap analysis is an alternative tool to assess the gaps between the current status of the program and vision of the future that was discussed in the environmental scan. Number 5, these goals and objectives are very effective when they are in SMART form, which is specific, measurable, achievable, relevant, and time-bound. And then finally, develop implementation plan provides the plan and strategies to accomplish the goals and objectives. This also includes the person or persons assigned to accomplish the goals, a schedule for when the goal should be completed, the current progress on that goal, and if the goal was completed, to be reviewed in the next advisory committee meeting. On this slide, you can see an example of an environmental scan from the Yale New Haven Hospital that was conducted to assess other health systems. This table outlines various institutions potential students explore when searching for a pharmacy technician education and training program. In the key findings, there is a hurdle Cleveland Clinic encountered in trying to recruit students, which they solved by offering an evening online program to attract and accommodate new students. You may find this as a hurdle for your program too and be inspired to implement a similar solution to overcome this. Along with key findings, the environmental scan will give insight on how competing programs are setting their program duration, tuition, and additional fees. It will help you determine how to structure your program's offerings to stay competitive and be a more attractive option to potential students. On this slide, we have an example of a SWOT analysis also done by Yale New Haven Hospital. There are 4 sections to this analysis: the strengths, the weaknesses, the opportunities, and the threats to the program. This analysis helps to highlight some goals that are necessary, assess any weaknesses that need remediation, and find opportunities for areas that the program may not even be aware exist. Threats found for the program may help in writing goals that can solidify the program against those threats. For the Yale New Haven Hospital, when evaluating their strengths, you can see that as an academic medical center, their system is dedicated to education and training. Additionally, as the hospital was expanding their system pharmacy services, they needed more technicians for this, and they already had many facilities for the training of these technicians. Other strengths included the diversity of technician roles within the department and an existing career ladder for technicians to promote retention and loyalty for technician staff. For weaknesses, the hospital struggled to find dedicated classroom space, which is not always easy to find in a hospital. This could be written as a goal in the strategic plan. Additionally, the program needed an FTE to run the program as well as qualified technician preceptors and instructors for the program. Funding is needed to achieve all of the listed weaknesses. Therefore, adding these in the strategic plan can be a way to justify asking for more funding for these specific goals. For threats to the program, the millennial workforce is relatively transient. It is a developing program that had to compete with local community colleges. The Northeast is a very expensive place to live, and some students may not be able to afford tuition for a non-degree program, and some technicians go on to obtain degrees other than pharmacy. For example, they may work as a technician while going to nursing or medical school. In addition, the question of how to sustain the program in a small state such as Connecticut was also one of the threats that was considered in assessing the feasibility of the program in the SWOT analysis. As you can see, the SWOT analysis can help you draft goals. This analysis causes you to look at the current situation of the program in depth and be creative in finding solutions that can be crafted as goals with strategies on how to complete these goals. A gap analysis is a tool to raise performance levels within your program. This tool identifies where the program is now and where the program needs to be at in certain areas. It also allows for actions needed to close those gaps between the current state and the future state. You can use any or all of these tools and analysis methods to help map out all the goals that you need to accomplish. Now let's put it all together. Here is an example of the strategic plan from the ASHP website to walk through the process of writing the strategic planning document. In the first column, you see a place designated for listing the goal and/or objective. In the first row, the goal specifies the exact pass rate the program hopes to achieve. This is then accompanied by the plan and strategy for achieving the goal and the objective. The who specifies who is in charge or responsible for achieving the goal, which could range from everyone in the program to one specific person. In the schedule column, there is a realistic timeline for completing the goal. This may be a realistic timeline when the goal was established, but sometimes it might not be able to be completed in that time frame due to unforeseen circumstances, and the timeline should be updated to the most realistic time needed to complete the goal. This should then be agreed upon by the advisory committee. To keep the people assigned accountable, a current progress and completion column is added. It is important to have agreement by the committee on situations that include timeline changes. To maintain accountability and relevance to the current practice model, it is important that the advisory committee reviews the strategic plan at least once a year. Members of the committee can make their comments on the plan to make sure the plan is both efficient and accurately reflecting their perspective. When a goal is mentioned in the strategic plan, a member of the advisory committee may assist the program to attain the goal. The end of plan revision is done every 3 years so that a new plan can be written. To start the process of pre-planning, the current plan is assessed for the goals that have been completed and any additional achievements that were made during the existence of the current plan, as well as any goals that were not completed that may be carried on to the next version of the plan. During the pre-planning stage, the planning cycle and annual review of progress will get you ready to create the revised plan. We have discussed the definition of the strategic plan and the process of strategic planning. So now we'll talk about how this relates to Standard 7 in the ASHP ACPE Technician Education and Training Standards. Here, we'll talk about how you can show evidence of compliance and what documentation is expected. As discussed throughout the presentation, the strategic plan document is reviewed every year, and a new revised plan is implemented every 3 years. To ensure that this is illustrated, create a new document or show evidence that a review has been done. For example, show edits that have taken place, date the new version with the current date, and have a printed copy of the old version to show evidence of edits made. Documentation of the advisory committee reviewing the revised plan must be done in the advisory committee minutes. Please ensure that specific changes advised by the committee are detailed and that the advisory committee has validated that they have agreed and voted upon the strategic plan. Standard 7.2a addresses the program's stand in the community, evidence of which could be holding career fairs, graduates filling the community's needs of technicians, and supporting the community to fill all practice sites in pharmacy. Programs should continuously assess the bandwidth of positions needed by pharmacy departments within their geographic area to ensure that they are graduating the right amount of graduates each year to address the community's needs. Admitting too many students may be a disservice to the community. since the students may not be able to obtain employment after graduation. Standard 7.2b states that the strategic plan should include short and long-term goals. Short-term goals are usually 1 to 3 years, and long-term goals are usually 3 to 5. Long-term can be continuous goals that the program is always working towards. For example, maintaining a 90% pass rate on the PTCB national exam. These long-term goals can extend to even a decade, and these goals are revised and updated with every revision made to the strategic plan. On the other hand, some short-term goals may be completed within a year's time. Standard 7.2c necessitates that the strategic plan includes specific and measurable goals which can be achieved by writing SMART goals, which were previously mentioned in this presentation. These goals could include equipment, such as technology for the simulation lab or supplies needed for the program, or any changes to the curriculum. Standard 7.2d states that the strategic plan has strategies for achieving the goals and objectives of the strategic plan. If you follow the example previously discussed, you will be able to document this standard well. Fill in the plan and strategies columns from the example document of the strategic plan on the ASHP website with resources needed to achieve the goals and where those resources will come from, as well as who is involved or accountable for completing the goal. Standard 7.2e requires that the strategic plan includes a timeline which can be achieved by filling the schedule, current progress, and completion columns from the ASHP example document. Develop these elements with your group to place within this document. Documentation here is essential. Standard 7.2f addresses the program outcomes. Program outcomes include the following: current national certification exam pass rates, program graduation rate, satisfaction surveys, job placement rates for graduates, admission rate, and benchmarks that are set by your program. National certification exam pass rates can be requested from PTCB and NHA. Ensure that these documents are reflective of your campus if your program is part of an educational corporation with multiple campus sites. You should now have a better perspective on how you can develop or enhance the strategic plan for your program. It is important to develop a plan for your program with the insight and approval from your diverse advisory committee. Do not develop the plan in isolation. Review the plan at least every year, with revisions every 3 years. Make sure and address your program outcomes in the plan and seek ways to improve outcomes of your program. It is acceptable to change the goals for your program. Strategic planning documents are essential tools to track the success of your program. Make sure and keep this a fluid document to pass on from year to year. Feel free to use the examples on the ASHP website, and if you have any questions, please contact asd@ashp.org for further assistance. Thank you.